Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's lecture topic is tumors of middle ear and mastoid. We divided our lecture into 5 sections. In the first section, we will talk about the glomus tumor. What's the classification of glomus tumor? What are the causes of glomus tumor and what's the pathology of the glomus tumor? Then in the second section, we will talk about the intratympanic tumor and polyp presentation of the glomus tumor. And then we will talk about the cranial nerve palsies develop as a result of the glomus tumor and then what's the audible brew. Then in the third section, we will talk about the diagnosis and treatment of the glomus tumor, how they are investigated, what's the treatment, and what are the different surgical approaches for the treatment of glomus tumor. Then in the fourth section, we will talk about the carcinoma of the mastoid and middle ear. And what's the etiology and pathology, what are the clinical features of the carcinoma and how we can diagnose and treat them. Then in the fifth and final section, we will talk about the sarcomas and secondary tumors. In this, we will specifically talk about rhabdomyosarcomas, some other common sarcomas, and what are the secondary tumors of middle ear and mastoid. So all this will be covered in our today's lecture topic, tumors of middle ear and mastoid. So keep watching sqadia.com to learn about this topic.